Do people experiencing homelessness have equitable access to primary health care?
No, no, no. They don't. They don't. They don't have. Typically, they don't have. They don't have a family doctor. And what's happened in our cities is, in many cities, is there has been a group of healthcare professionals that have come together and that have either done outreach into the shelter system and on the street for people who are rough sleeping, and it's provided kind of a crisis response, or at least that includes primary health care. Um, so so we've seen, particularly I would say over the last 20 years, the evolution of shelters that were, historically just to help people have a place to stay, and often would serve, would have a food program. They've now included primary care, mental health services, addictions treatment. So they've almost become these service hubs, which, from my standpoint, responds to a need, but is a bit problematic because they kind of go against the housing first philosophy, which is to get people into the community and get them integrated. But having said that, there's an immediate need, and that's what they've been doing. But they reflect the situation that people who are typically people who are homeless they haven't had access to continual, consistent primary care.
We found that in our research up in City of Kawartha Lakes, talking to folks who, we have this system of rostering physician
Yes.
offices or NP offices, and they roster. And so we'd interview the folks and they'd say, well, have you got a primary care person? Well, I'm rostered and I'm not happy because I'm
Yeah.
now living in Lindsay and I have a primary care physician who's in Fenland Falls, which is a
Yeah.
25-minute drive. And I can't get a different one because I'm considered rostered and I can't get there.
Oh, yeah.
Yeah,
Yeah.
and I
Yeah.
haven't met them yet, and I'm not getting any
Y-
continuous care.
Yeah. No. No. Absolutely. Eh? I
Yeah,
mean,
yeah,
it's kind of the hierarchy of needs. Eh? I mean, health should be primary,
yeah,
but the main need, people are they're just trying to stay safe and sheltered and so on,
yeah.
and